People's health in Salford is improving, but not at a rate comparable to the rest of the UK. To solve the problem, Salford City Council decided to take action. Being Well Salford is a new service commissioned by Salford City Council to support people to make changes to their health and well-being. In this film, we chart the beginnings of Being Well Salford, from design to delivery. We talked to Faye Selvin and Lizzie Twells from Big Life, and to one of the commissioners, David Hearn, about why this commissioning and design of this service was so different.
The issue now is about people with long-term lifestyle issues and how they can sustain change. So we're talking about smoking and weight and exercise, all the things that, they're really hard to do when you're struggling with day-to-day life.
Where in more affluent districts people might have one or two of those sorts of problem behaviours, in Salford chances are people would be having 3, 4 more.
So it's about how do we design something that isn't about just picking off smoking, picking off drink and saying we're going to work with you on your smoking or drink, working with people in a way that made sense to them.
What we're expert at is working with people around self-help, self-management, and we complement what the hospitals do.
So rather than just put money into the existing services and grow them, to use the opportunity to do it differently. We were extremely thorough in running a very robust procurement exercise, so full PQQ process at the beginning, deselected a number of organisations through that, and what was already coming out of that primary process was that Big Life were a very strong contender. It was transparently obvious even in the first round of that process. When we got through to the second phase and we were looking at the more detailed proposals, it was really obvious that Big Life were offering something quite radically different to anything that we currently had, and ticked a lot of the boxes that we were looking for, particularly I think in terms of the aspects around social return. So there were some very, very specific aspects to their bid that I think set them apart. So the emphasis on recruiting local people to be the mentors, so people like me, helping me with the problems that I'm dealing with.
We ended up recruiting 16 staff, and 80% of those staff live in Salford. So it's the power of that local pound, that's all being spent back into Salford.
The emphasis on capacity building with third sector organisations, so that it's not just money shoveled into one big, frequently statutory organisation, it's dispersed.
Well, in Salford there's a really good range of social enterprise and voluntary sector organisations already working here, and they all have great connections, great experience, great understanding of the area.
And then some really creative aspects in terms of the way in which they were linking it into the university, in terms of designing completely new training and development approaches around it.
The commission was fantastic because for the first time commissioners gave us the opportunity to design a service.
Clearly there's some real merits in doing this through a third sector with a lead provider, and seeing that lead provider as the one that holds the ring for us, so that we're not having to talk to the whole of this system, but that we can trust Being Well to be managed by the Big Life.
We put forward a model about how we'd go around solving it, and then we worked collectively. We had about 6 months to actually design the service with all the partners who are going to be involved in it.
In terms of the previous sort of big statutory sector providers who would have had this level of service, bottom line is none of them would have been in a position to do the development work in local communities that they have. They couldn't have done it with the third sector in the same way. It's highly unlikely that they would have recruited in the same way.
We also talked to Jill Wild from Salford University about the training and processes that Being Well Salford has used.
When they approached me, I felt we had the skills and the knowledge in the School of Nursing, Midwifery and Social Work at the university to deliver the programme.
What works in groups versus what works in a one-to-one, and what works in terms of the communication skills that are most effective in supporting change.
We were really interested that they were going to employ people who lived in Salford and to also work with the people of Salford to improve their health.
There is evidence about what works when you are working with people on smoking. For example, there is evidence about what works when you are working on alcohol. What there isn't is an evidence base that says what works when you are working with people who have multiple issues, and whether those individual bits of evidence still apply.
We've learned a lot through the co-development, and I think we've tested the limits at which you can have that sort of adult conversation between the commissioner and the provider.
I've never had the pleasure of being at the beginning of a project and developing a new service really from a blank sheet of paper.
I can't say enough about how much working with other people who've contributed has made this so much easier than trying to do things on your own. It's been a brilliant process from my point of view.
The bulk of the conversations that are happening in most local authorities at the moment are about downsizing, re-engineering to shrink, and then here we are putting a new thing into the system and saying, well, actually there's capacity for it to grow and potentially take on other things. Actually, if you're creative about it, you can see the way in which Being Well could support some of those other discussions about re-engineering to save money.
One of the reasons why we're doing this video is because we want to sell this as a model of commissioning, because it's been great. I hope that when we start getting the outcomes in, as we've been rolling out the service, that people will see that it's been really worthwhile doing it this way.
From our point of view, I think the key thing now is to understand what it's doing in terms of the way in which it's impacting with the local people, but the early case studies that we're seeing are extremely positive.
I think we've got a really good basis to do other work together, and that might be in the same group or it might be in different parts of the group and bringing different people in, but I would like to see us doing more work like this in the future.